All right, thank you everybody. We're really glad to have you here. This is a really fun topic that we're going to be covering today, which is the data discovery process and how we work with stakeholders, community leaders, state officials, extension professionals, data scientists, faculty, students, staff, postdocs, all sorts of people in really trying to uncover data. And this is kind of the precursor and a natural part of the data pipeline, but it's something that a lot of people haven't been trained in before. So I find this an incredibly useful tool and resource, and I loved being trained in it. And I'll give a shout out that Deviko is the first person who trained me in this, and she is here, so she is awesome, and I appreciate her going through that. And this was developed by Sallie and her team. So we're really lucky. Sallie's going to jump in and join the presentation, but I thought I would introduce her. I don't think she's actually been introduced so far in this process. And this will just be a smidgen of kind of what she's done, but I wanted to let you know how lucky we are to work with her. So Sallie is the Division Director of the Social and Decision Analytics. It's not lab anymore, division.
Yeah.
Division. And a distinguished professor in the Biocomplexity Institute. She was the former American Statistical Association president. She is a member of the National Academies of Sciences. She is behind this Data Science for the Public Good project and linking it to extension and making this go from a Virginia Tech to a Virginia to a tri-state network. She worked at Los Alamos as, and brought in all sorts of new ideas about how to use Bayesian methods. She brought that not only to what we're doing in working with military, but with companies like Procter & Gamble, with local and state agencies, with federal agencies. As a dean of engineering, she helped to create the Oshman Engineering Design Kitchen, which has won all sorts of awards. People have gone on and invented and created really cool things for this project that she started back when she was working there. And I believe, have you also been a provost? Is that right? So Sallie's basically held every major position at universities that you can imagine and done so much in her career. Also finds time to mentor many of the people who are on this call. And as someone who receives mentoring from Sallie, I greatly appreciate her and her advice and the things that she has taught me, including all of this about data discovery that we're about to untap together today. So we're very happy to have her with us. And Sallie, I was going to open this on my machine, but would you rather share your screen?
Oh, go ahead, you can open it on yours.
Okay. And we will get going with this. And we'll give the reins over to Sallie as soon as we can get this screen to show. All right.
Well, Cass, thank you for that very lovely introduction. And you can go ahead and go to the next slide, which is really just an advertisement for what you guys are going to do. And so today, what you're going to be doing, and you saw this figure appear in our presentation earlier today as well, you are going to learn about the data-driven discovery process. And so what I want to start off with is just to kind of step back a little bit. And if you remember, the data science process starts with identifying a problem. And so that when you think about how are you going to use data to inform decisions, there are just some key questions that you really should have in your mind. And these questions, by the way, are relevant no matter what your background is in data. So as you're working with stakeholders and other leaders and other individuals and working with them to share data insights that you've created, getting them to help you think through what kind of data insights would be useful to them, even if they are not at all data savvy, you should encourage them to think about these same questions. And they are, you know, what is the problem that you're really trying to solve, and what are the questions associated with that problem? What types of decisions are you trying to make? And we'll come back to what a taxonomy of types of decisions are in a second. What data is available, and why should you trust the data? Because again, a lot of what you're going to do and learn as you go through the data discovery process is you're going to learn how to sleuth out really cool data sources that you may never have thought were out there at all, let alone be able to be applied to your problem. Well, how do you trust that data? It's not something that you collected on your own. And then what types of analyses do you need to inform the decision? And then finally, what are the ethical considerations? So these are questions that I like to talk about as being the foundations of data acumen, and so that you can really understand how data can support a particular problem. Go to the next slide. So we're just going to start off today again with reminding you that there's a data science framework, a data science process that we're going to walk through. And today we're going to walk through those first two parts, the problem identification and then data discovery. So on problem identification, it's useful, go ahead to the next slide, Cass. It's useful to start with a couple examples, and then we'll test out a little bit what you think about the types of decisions that are of interest to the decision makers, to the stakeholders who have these problems. So let me share two examples. You've heard a little bit about both of these already. The first problem was one of our earliest problems with Arlington County, Virginia. And what they were really interested in for the problem was how to improve quality of life and services while accelerating the county's efficiency and resiliency. So that's a problem. And they had a goal. They wanted to see if developing data-informed situational awareness, you have the situational awareness, what's going on right now, if that could help their goal. Now, neither of those two things are framed up in a way that you can actually start some research. So you really need to start to break that down into what are the questions that you would like this research and these data insights to help support. And so the question that the fire chief posed to us, he wanted to know if it was possible to link the fire EMS data end to end to recreate incidents so that he could understand resource utilization and other aspects of how the fire EMS processes unfold. So now that's getting down to a question where you have an opportunity to start thinking about what literature might you read, what research might you start to think about, what data sources might help inform that. So the second example is the Fairfax County example. So you read about this in the Harvard Data Science Review article. And there, the problem that they were interested in was to identify barriers to economic mobility. And their goal was to use this local data or to drive data insights down to a local level, sub-county, sub-city level, neighborhood level, to inform countywide long-term issues and establish baselines for policy and program evaluation. Once again, neither that problem nor the goal, has enough structure around it to be able to really dive in and start to think about the research that you could do to help support that. So working with them, here's their first question. And this came from Health and Human Services. And the question was, what are the neighborhood trends in youth obesity, access to healthy food, and physical activities? Now you've got some meat on the bones that you can start to think about. Okay, let's go to the next one. Still thinking about problem identification. The question is, what's the problem? What are the questions? We just talked about that. But then you also want to work with your partners on what types of decisions do they want to try to make? What types of decisions do they want to try to support? What's in their span of control to even do anything about? So we have a taxonomy of decisions. Next slide. And the decisions sort of fall into these bins. I'm going to start at the bottom. There are what we call tactical decision making. That's really support for ongoing operations and actions. How do you support that day-to-day? If you think of the fire EMS data, it gets generated to administer an incident as it unfolds. It tells the unit where to go. It helps provide insight on different medical actions to take when they get to the site and they're finding out what the situation is, those sorts of things. That's tactical decision making. Anticipatory decision-making is when you would really like to detect and identify emerging issues and discontinuities in things that are happening. So you really want to try to, predict a little way out, forecast a little way out. You're really trying to detect, what could possibly be coming up that's going to cause some discontinuity in operations or some discontinuity in actions that the stakeholders could take. And then finally, the longest run out type of decision making is strategic decision making. And this is where you really want to inform and enrich your understandings of problems for future operations, for developing future operations. When we've met with police departments in different cities and counties, they never really ask for help in building a real-time dashboard to tell them exactly what to do. They're not asking for tactical help. What they're asking for is, can data insights provide me some understanding of what my force needs to look like in 5 years, and what parts of the city are going to be changing, gentrifying or not, in such a way that I should be planning resources and, you know, morphing resources out in that direction. That's an example of strategic decisions. Okay, so let's take a little test. So can you guys vote, or somebody watch voting here? So go to the next slide. So first example, Arlington County. In that example, I'm curious as to what you think as to, is this question, the goal and the problem, about strategic decision-making, anticipatory decision-making, tactical decision-making? So you guys get to vote. So if you think it's tactical, put your hands up.
And by that, if you go under the participant link in the middle and you click on it, you can choose to raise your hand, and we'll be able to see that.
Or you can choose your yes, either one.
Oh yeah, or the yes.
So if you think it is tactical, put your hand or your yes up. Very good, class. It's not tactical, and I kind of gave you the clue. Okay, if you think it's anticipatory. All right, got some hands going up. Yeah. How about strategic?
Okay. We have a lot of hands on the participant link.
Right. Okay, so in fact, if you go to the next slide, Cass, it's actually both anticipatory and strategic to support force and resource development. You know, anticipatory and strategic frequently go hand in hand. So for that particular example, it was really a combination of those sorts of decisions. How about the next problem for Fairfax? What do you think? Is it tactical? Whoops. Oh, man, operator there, Cass.
I know.
We can just jump to it. Go ahead and just jump right to it. So in this particular case, it is also anticipatory and strategic, and I see your hands kind of going up and down. So you can go to the next slide, Cass.
Okay.
So they're both anticipatory and strategic in this particular case. And so let me pause before Cass goes into the data discovery and see if, before we close out this first part, are there any questions or any comments?
Yeah, I had a question. What are times that you're more often to have a tactical type of question? What situations tend to give tactical questions more often?
So the sorts of things that'll be more tactical, and the data science that'll come together on tactical questions. This COVID situation is a great example. So you hear a lot about people trying to do contact tracing and building apps that actually will try to take data and do different contact tracing, try to do the algorithms to determine who's been close to whom, or some of the work around trying to, oh, just lost my train of thought here. Some of the work around, the apps and things that are built to try to monitor symptoms and decide, you know, who could come into work, or the data insights that might come together to determine how to manage volume within an enterprise as it starts to restart. So those are some examples of tactical situations with regards to restarting an organization as a result of a pandemic or a natural disaster. And so in those particular cases, what you want to do is to understand what are the tactical decisions that they're trying to make or they could make and have to make them rapidly, And then what is the data that's going to support the understanding that they should do A or B at that moment? And it is the case that, you know, the real-time policing with the cameras and the dashboards, you know, those would be examples of tactical decisions, tactical decision-making, and decision support, artificial intelligence, and different data science tools to support those. I will say that in our work with communities, we haven't been confronted very often with them wanting to have us support them in tactical decision-making. You know, they're actually pretty good at that on their own. And what they tend to do is want help more in the anticipatory and strategic space.
There's a question in the group chat about why is it important to distinguish between the three types when you're, you know, when we're working with people, why do we want to distinguish?
That's a great question. You want to distinguish because you really need to understand how useful will the data be, for example. So if my goal is to support real-time policing, probably ACS demographic data is not going to be terrifically helpful for that. So, you know, data has a lifespan of periods of time it covers that can really be helpful in the data insights. And so you really want to know that so that you can tell whether the data is going to be relevant. The other thing is that the types of models that you build. If you're wanting to look at strategic decision making, you're going to want to think about how can I try to develop some models that will forecast into the future, or how can I develop some environments, platforms of models where somebody can actually exercise different policy options and see what the outputs are. We call that counterfactual analysis. You can actually exercise that to try to see what implication a particular policy will have and over what time frame. So that's why it's really quite important to know which of those decisions, so you know what point in time you're looking for and the sorts of things you're looking for. And honestly, it also puts some constraints on how fast you have to get that research done.
Thank you. Any other questions for Sallie?
Was that clear on that last one before? Because it's such an important question. I'm not sure who asked it.
The asker said yes.
Okay, great. Thank you.
Okay. Then I will share my screen again and we will have a chance to learn some more. So the second part of this process, we start with this problem identification, and you really can't move forward until you understand what people's problems are. And as Sallie talked about, it's really important to understand the type of problem you're going to be wrestling with. So is this a short-term current tactical issue? Is this a long-term strategic plan that you want to help people with? And once you kind of frame exactly what that problem is, or the framework for what that problem is, then we're ready to do some data discovery. And I want to pause for a minute and say, I found it really, the first time I walked through this process with Sallie and her team, we were doing it live, we were doing it with the community, and they asked the question, you know, what is it that keeps you up at night? What is it that what is your most pressing problem? What can we help you with? And that was really the way this conversation began. So as we're identifying problems, I want to point out again that we're not going to people and telling them what their problems are. We're not telling them how they're going to solve the problems, and we're not telling them what the solutions are right off. What we do is pretty different. We go in and say, you tell us what the problems are, tell us what your assets are to solve them, and that's what we're going to do next in this data discovery phase. And then we give you what we think are data insights, and then work together to think about ways that these might apply to real action. So it is not this like just pushing things at someone, it's partnering with people. And that's really important in this stage of the game too, in the data discovery, where we inventory, screen, and do acquisition. So we have to figure out what the type of decisions that are going to need to be made. We want to find out the kind of data that will be available. We want to know what our criteria are for selecting things. And then eventually we're going to acquire the data. And this is really an open-ended process. And the reason this is an open-ended process is you might get down pretty far in this process. You might think you have like 5 winning data sets that you're going to use. And then it turns out one is super duper expensive and you're not going to be able to use it. And one you just couldn't get the legal agreement in place and you're not able to use it. And maybe one it just really isn't a good fit. So now you're going to go back and start over and brainstorm more and think through this process again. And so I think it's a real benefit that this is an open-ended circular process that you can re-engage in multiple times throughout. So this overall framework that you can see on the screen is this larger data discovery process. And we're going to do two activities today. One is going to be on the data inventory part. We'll also talk a little bit about data screening, and then just give some tips for the data acquisition to develop your own data assets. Oh, and I will say, I guess I didn't read these, that the data inventory, this is not inventorying what you already have. This is our brainstorming wish list of everything we might be able to get our hands on that would answer this really pressing question. So there's some benefits and challenges to this approach. And I'm going to start with the challenges, which are on the far right side. Sometimes it's difficult to identify the relevant data that is out there, that's available, that you can use, that makes sense to use. And then evaluating its usefulness and applicability, selecting those data sources, acquiring the data, and assessing the quality. Those can all be hurdles that create problems for you and your team as you're working through this process. On the other hand, there's some huge benefits here. And that is that you can do it faster, and you can do it cheaper, and you can get more people to do it at a greater geographic granularity and over time if we can link into these large-scale data sets, including administrative data, which we'll talk about in just a minute. So there are a lot of benefits that when we're not just collecting our own data, which we've been collecting for a long, long time. You know, one of the great innovations of data science, I think, is shifting from feeling like we have to generate each new piece of data and rather tapping into lots of the existing data that are out there and reshaping it to fit and help with the current problem at hand. And overall, the outcome of kind of taking this approach to using data is you get a much richer source material. You can pull from lots of different kinds of data to illuminate a problem, and you have an informed project vision. Working through this with your stakeholders, talking with people through this process, bringing in lots of different ideas and lots of different data. At the end of this, you have a more collaborative, multidimensional project. So one of the things we think about as we're doing this data inventory, you're going to see as we go through this, we're just going to try and like at every step get your mind to go like broader and broader and broader and broader in your thinking. And then when we get to screening, we'll try to get narrower and narrower and narrower. So right now, you know, this is actually, let me just pause and say, you're hearing this in two ways. On the one hand, this is really important, like interesting information. I hope you all enjoy this. On the other hand, you're going to be doing this with your teams in the next week. Some of you, it will be in the next 2 weeks, but you'll be actually sitting down with stakeholders and going through this process with them. And so feel free to stop me, not just if things are confusing, but if you're like, but how do you say this to them? That would be a really useful part of this conversation. So I'm going to walk you through it as though we're going to do a data discovery together. I'm going to walk you through an example of a prior one that we've had. But this is also training for you so that you're able to carry this out on your own. So feel free to stop with questions. We have people monitoring the chats. They can stop me at any time. You can stop me and we can answer those questions. Okay, so in this first step, now we're going to just try to let our minds get as big as possible when we think about data. And the first way to do that is to unlock and say data can be anything, right? And there are big buckets that data often fall into. So we have all of the design data that if you come from a social science background like me, you're really comfortable and understand a lot about design data. And then we have administrative data, which is this whole new world of data that's been collected forever. It's required by law for people to put it together, but it's often not utilized. And so we have state agencies, programs, community programs, state programs, local programs, federal programs that have to put in their little inputs each month, each quarter, and say who utilized their program and sometimes measures of whether or not it was successful, but at least we have counts about who used it, when. And it's this vast resource, especially when we can link it together to understand when people come into contact with these sort of programs and through multiple programs, what can their long-term effect be? So this is a huge area of evidence-based policymaking that's growing all over, as many states and localities are really starting to use integrated administrative data. And then we have opportunity data. And a lot of the people that are on this this Zoom right now have used opportunity data, love opportunity data, and have great ideas how we're going to bring opportunity data to bear on the questions we have this summer. And I'm also very excited about this as well. And then there's procedural data. So this can be the bills, the rulings, the briefs, the things that kind of constrain the context in which we are living and doing our work. And they can be really useful both as a comparison across different geographic areas if they have different laws and procedures that may impact both the decision-making and the output. And this can be a really useful way to think about what's going on in the places that we're studying, or that we're working with would be better. So earlier today you saw the data map, and I want to show this again. This is slightly different. This was a data map that was created in thinking about broadband in rural places. And I think there's almost no more relevant topic today than thinking about broadband in rural places. As everyone has been going through COVID, we know that your access to broadband determines whether or not you're able to productively engage with your work, if you're able to engage with your school, if you can access telehealth. Suddenly, more than ever, people's access to broadband has been questioned as a human right. And for a long term, it's just been people have been interested in it as a, like, oh, it's quaint that all these places don't have broadband. And now we see that it's like this really necessary thing. But when Sallie and her team took on an issue of trying to understand broadband in rural places, they created this data map. And that included, and when you're trying to think about this issue of broadband, that included things like broadband itself, availability and number of providers, type, speed, adoption rate, all sorts of things. And it also includes information about the people who are using it and their geographic location, their neighborhoods, their communities, their property, the housing, the developmental factors. So we have a lot of things about like, what is the institutional built resources? Now, I have to admit that the reason I use this example isn't just because of COVID and broadband, it's because we are trying to wrestle with what really helps and inspires economic mobility in our communities, which I think is tied to all of the factors that we have here, and I want to get these front of mind for people. And also, as we're thinking about these community capitals, what are the assets of the communities that we're working with? We want to be able to think really broadly across all of these domains. What is it that communities can draw on from resources when they're trying to be resilient or to recover from things like COVID? So you can see that we don't want to think really unidimensionally. We want to think really broad when we're solving many of the problems we're faced with. And that's because of these data domains. So in each of the boxes is one of the data domains that we might think about when addressing a problem. So even if you feel like your problem is this, just little thing, there would be all sorts of data domains that might influence it. So again, you just want to think bigger. How broad can your thinking be at this point in the exercise? So the example we're going to run through with you is a real world example. We did this with the Department of Public Health in October. And this was the Iowa Department of Public Health, and they came to us and said, we are interested. We don't want you to build this for us. We're just interested in understanding, is it possible to monitor drug use and its impacts on individuals and families throughout our state? So I want to pause for just a second and say, given what we've heard about strategic, anticipatory, or tactical, which is this? What kind of decision-making were they asking us to help them do here?
And as you guys are thinking about that, Cass, you do have one question in the chat, just asking, are the domains the same for every project, which we're going to get into in this example. But if you could speak to that a little bit, that'd be great.
That is great. We will get into that in just a minute, but no, the domains will not be the same for every project. However, sometimes when you're in this phase and you're just letting your brain like get as broad as possible, don't close any of those out. Write every domain you might think of. We'll go through an exercise in a minute where it's like, just put everything you're thinking of, because this might be a really good idea that you want to latch onto later. But some projects really need you to focus in this area, and some projects really need you to focus in this area. And so those domains will differ from project to project. But core ones like the demographics of your community, those are likely to be pretty consistent. You're likely to have many similar ones across multiple different projects. Okay, so here's my question. Who wants to be brave and say, do you think this is strategic, anticipatory, or tactical?
I would like to say it's anticipatory.
Okay, and why do you think that, Kishore?
Because I think the Iowa Department of Public Health is trying to mitigate the drug use in Iowa. and so they would want to get a start on what kind of individuals are impacted by it, and how is the drug use, and how the families are affected by it. So I think they're anticipating that there are people who are getting affected by it, and they want to know more about it.
So I totally agree. I actually think there are two right answers, but you nailed one of them. Good job. So this is anticipatory in the fact that they were saying, we want to know where hotspots are. What if we could track and get an idea of when drug use is on the rise in one particular community? Then maybe we could increase resources. We could send in some additional programming efforts. We could start doing targeted enrollment plugs, try to get people to join the programs that we already have so we can lower that. So there was definitely, we want to be able to see what's going on and respond to it quickly. What else might they be thinking here?
Somebody submitted strategic in the chat.
Okay, great job, Michaela. That is exactly right. They also want to be able to make long-term decisions. Where are the communities where this is really growing into a big problem, so that we can foresee like that we're going to need to do some long-term investments there to help change that. So like many projects, you do want to think about what are they trying to assess, because that's going to tell you the range of data. You know, if I want to be able to anticipate what's happening, I'm going to need a data pipeline that can continually update, or at least can update on a regular enough basis that I can monitor that. It can't just be something that happened 5 years ago. That would be, you know, even a year ago is probably out of date. I need to get something that's really going to be monitoring. So the data I need to keep in mind is really going to be framed by the type of question they're asking me to answer. But this was a huge win to get them to actually come down to a very specific question. And there was a whole meeting where this is the only thing we said, no, let's get your idea, let's get your pressing problem into one sentence. And we really worked that. And back to Devika here, she is the one who told me that that is what we had to do. So good job. But if we did not have a good question, we were going to be like really hurt when we started this process. We took that seriously. We worked with them. We came up with a question. It was fantastic advice. Because then we were able to move this into the next part of the process, which maybe we'll be able to go over to that slide. Okay, so then we're able to take that question and we're gonna work it through our data discovery process. So we have this issue: how can the Iowa Department of Public Health better monitor drug use and its impacts on individuals and families? We're gonna work together to do a data inventory and a data screening. And so in this first step, I'm going to show you, first I'll show you something and then I'll have you respond to it. We're going to try breakout rooms. So this may work terrifically or be horrible. I'm really not sure, but it should be fun to try. So this is what we'll do. So for our first one, our goal here is that we want to make a wish list of all of the data set ideas that we can come up with. So again, we've just been brainstorming with them. We're trying to talk to them about think big ideas. And we want to find out is what information and data would be useful to help them monitor drug use. So we started by, you know, now I'm going to put on your hat that you're going to be in the community here. And we started giving them a handout that looked very similar to what you see in front of you. It wasn't quite as colorful, but it was very, very similar to this, where we had the question, the problem articulated. We identified through a literature review before we went some of the themes. And then also we did qualitative studies, which this team will not do ahead of time. And we identified things that were really important for drug use. So the social context of drug use includes family, community, church, and occupation. That may seem like a no-brainer, but again, we're trying to get people to think this is not just an individual level problem. This is a context of the relationships that you have growing outward from yourself and all the way up to your communities. The triggers for drug use, we found this through qualitative interviews, were social isolation, stigma, economic vulnerability, and trauma and coping. And I know that my team has heard this, but I'm just going to say it again as a plug. You know, about 2 weeks ago, the CDC did a webinar on this issue. Our state is incredibly interested in it, and several of our projects this summer are around this. Because what our research has shown is that these are the things that trigger use, relapse, and death. And if you think about what's going on right now in America today, we have serious issues with social isolation because of COVID, economic vulnerability because of COVID, and trauma and coping because of COVID and everything else that's happening with all of the riots that are happening throughout the country. So when these three factors come together, what we can assume is there will be a tidal wave of need happening around substance use in America, that we're going to have use rates go up, we're gonna have relapse rates go up, and we're gonna have death rates go up. So the question is, how do we monitor it? How do we capture it? And how do we do it fast enough that we can react and respond and help? And preferably with the big goal of let's save some lives. So who's going to be engaged and impacted in this work? The second column. There are lots and lots of people who could be involved in thinking about a big monitoring system. We're going to have agency partners, cross agencies. We might want to get data sharing agreements with lots of different people. We want to work directly with community leaders and community action agencies, with treatment centers, needle exchange networks, program clients, medical professionals, the criminal justice system, and everyone in this room. Anyone who is willing to participate and give their ideas, we would like to partner with you. Those are the people we need to engage with to make sure that we get this as big and as well thought out as we need. And then who's impacted? Well, this is just our starting list. In just a minute, you're going to go into a breakout room and you're going to make this list even better. But at a starting place, we think all of the people that we mentioned before, as well as the children, families, adults, employers. The people who are impacted are even larger than the people who might get engaged to help you solve the problem. But you want to think about who can you work with? Who are your natural partners? Where do you already have strengths? How can you leverage those? And how can you build from that to actually do some good with the data insights that you develop? And then you want to think about the end result. Who will this impact? And are the decisions and insights that you're creating, and is the data pipeline you're creating going to effectively meet their needs? So both of these are really crucial at the beginning to get people thinking about what are these two processes. And then you think this is very similar, but what are these internal or external factors that affect this space? So these could be laws, programs, informal support, state and community resources, stakeholder preferences, individuals and families. This could be something like, we have a super annoying person on our city council that will never let this law pass. And if you know that at the beginning, that can really frame how you might do workarounds with some of the insights you come up with. So knowing something from as granular as there is a really serious political thing going on that we need to address and think about, to there's a person going on that we need to think about, to what are all these other factors. And this is just a time for the decision makers to have a chance and brainstorm what is it that's going on. But before you go to your breakout session, I want to point out the fourth column, which is my favorite thing to talk about of this entire day. And that is, what is the desired outcome of the process? So in a week or two, when you're working with your stakeholders and you get to this part in the data discovery process, I encourage you to slow down and to take time and to ask them, what is it, if you imagine that this will work, you know, let's use an appreciative inquiry model here and say, let's build from a strength-based approach. Let's envision that this project actually came to fruition in 5 years and it's successful. What are you going to do with it? What are you going to do with the results? How could you use them? What could you do? So what are those outcomes you're searching for, and what are those good things you might get? Because the answers to this question are the things that you will be using to motivate your partners as you go through, because it helps you realize what the scale and scope is of what's going on, and it also helps you to commit. So before we break out, let me leave you with one of my favorite groups. This is the Allegheny, Pennsylvania group. They use an integrated administrative data system, and they work with partners. It's not quite this data discovery process, but they do something kind of similar where they work with partners to address problems that arise. And then they go into their data and they try to find evidence that might shed light on what they're trying to address. And what they decided for their state system was that they would not take on any data science assessments of their data unless they committed to act on the results beforehand. So one of their examples is they said, we know that we really want to find out how we can reduce the number of people who are dying from drug overdoses. So they got together and said, okay, here are some of the data, just like we're going to do. And they said, well, what are we going to do at the end of this? And they said, if we find something actionable at the end of this, we're going to do something about it. We'll be willing to make a policy change or make a programming change. And so at the very forefront, before anything was done, they made that commitment. And this is kind of our similar version of saying, now's the time to make that commitment. What is it that you think you could get out of this? And let's really talk about that for a while. So that is your charge. You're going to go into breakout rooms. You'll have 10 minutes. You'll talk a little, spend about 5 minutes talking about who's engaged or impacted and the internal and external factors. We'll spend about 5 minutes here. What is your desired outcome? If you imagine that you are who you are. You live in a state. You have lots of people around you that you know, that you love, that you work with, that are in your community who have substance use disorders. So what is the desired outcome? If we could better monitor and find that and target that, what would be a positive benefit that could come out of this? So I'm looking forward to hearing how your conversations go, and we will see how this works.
Cass, before you send us into the breakout sessions, can you give everybody the code for Mentimeter?
I sure can. Hey, Kels, you're the best. Thank you. Let me put this in the chat. So we have our Mentimeter account. Actually, Kels, can you put it in? I have to end the slideshow for me to put it in.
Yeah.
Oh, no, I know what I can do. Even easier. Watch this, everybody. There's a slide for you. So if you go to www.menti.com and enter the code 863791, you will be able to answer the questions that come up. So go join your breakout room. We have some excellent people there to help. Be nice to them. And give me any questions you might want to know. I'm opening the rooms now, and please, if you are one of the moderators of these sessions, please have this on hand because people might not have gotten it all. Okay, thanks everyone. Oh, we're almost there. So you've been invited to join a room, please do. How would you use the substance use monitoring system to support your programming or policy efforts? So some of the answers are maintain the data pipelines, be able to respond more holistically, understand the social determinants causes, so that you could figure out critical points of treatment, to target treatment, to consider access to education and other institutional resources, to monitor how people are coping during the recovery process, to be done holistically, for education programs, for having a better understanding of the factors of the substance abuse in the community, and then be able to figure out who to target, to allocate resources. So these are all really great responses that we're capturing. And when this is done, I will post these all on Microsoft Teams so you can go and see everyone's responses. I mentioned this when we started it, but let me mention this again. All of your responses are anonymous, so feel free to write what you think. Use interviews with stakeholders along with administrative data, inform medical pharmacy, support local groups, target and evaluate interventions. I added one too, and this was the one that came up when I was working with the state decision makers. And they said, we can use these results to apply for federal funds so that we can actually help people. So we would love to have data so that we can help people. And that data is really a bridge to getting resources for communities. Okay. So hotspots, allocate resources, use as a baseline. I think these are excellent, and I want to get us to this next idea and think about some of these things that we're talking about. So let me pick up where we were. Oh, that's not quite where we were. Sorry if this is making you dizzy. Oh, this is where we were. All right, Kyle, do you have a question?
Yes, I had a question. So when you present the data to the politicians, right? I know sometimes you can present data with certain purpose, but has there ever been a situation where that you were worried about your data might be used in the wrong way, or you give it to a politician and they do something with it that you weren't intending? So
my data has been used in the wrong way numerous times over my professional career. So that always happens. So it doesn't always happen. Let me clarify two things. One is when I was doing this wasn't actually with the politicians, although on the back end, we did start inviting a couple politicians to it because we saw the need for policy advocacy in that way. We did it with all of the program staff who worked in the state government. So this would be like the deputy director of data management was there, and the state epidemiologist was there. and the bureau chief over the Substance Abuse Bureau was there, and someone from the preschool, from the Department of Ed preschool programming was there. So we had people from all different types of programs and state agencies there, and they're the people who work kind of day in and day out to make government work. They are not the people who can advocate for policy changes. In fact, so much so that they have to make partners with other people to go advocate for policy changes. So they can't take the data and say, the no-brainer here is that we need better laws. What they can do is they can say, under the current framework of laws, how can we use the data to inform our own policy, our own internal policies and our programs to change that? However, you get a lot of traction when you change laws. And so we have started making strategic inroads with policymakers and been investing with them through some of these processes as well. But I have never done this with just a full group of policymakers. I tend to work with community action services, directors from across the state agencies, local government. To the other question though, I'm a demographer and I do work on complex families. And so people who have children with more than one person. And my work is demographic, which means for a lot of people, it's probably boring. I say this many people have kids with more than one person. But people have taken that and they've published it as, I think the worst title is something like, America is going to hell. And then it was like a focus of my research that showed how I proved that America was going to hell, which is absolutely not at all what I believe or what my research shows. That's happened numerous times. I've been in the press saying that because I'm supportive of really complex family types, that I must be supportive of the current president and his families. I mean, that was Washington Post. Like, good newspapers will misuse your data. So what I tell myself, so I don't feel bad about it, is I try to be as accurate as possible. I try to document everything. I try to show everything. And I don't tell people what to think. I try to be like the bathroom scale. Like, these are the numbers. This is what it is. And then help them frame it in a way, often from like a positive growth way. But once you put it out there, especially with open science, people can use it in non-positive ways as well. So making sure that you have the right people at the table, the decision makers, and helping them see it through kind of a positive developmental lens, I think is the most effective way that I found. Yeah, that's always a stress for anybody who produces research.
I think we have a hand up from Kyle.
Oh no, I already asked. It was, yeah. Sorry about that. Yeah.
Thanks, Kyle. That was a great question. Okay, so we've had some really fantastic, I love the results. Thank you. Again, I will share these back with you, but those were really helpful. So let's think of our next one. It's what other data domains are we missing? So when we take this substance use problem on, we have substance abuse and health. Definitely, if we want to think about a monitoring system, we should be monitoring the actual use that we're talking about. So that could be opioids, marijuana, alcohol, cigarettes. Let's not just think about one group, let's think about lots of groups. We should look at mortality and crime and drug distribution, mental health, physical health, risk taking. So we thought really broadly. And we got a team of people in preparation before this started and said, give us all your great ideas. And we thought that that would be like, wow, we've done a lot. This will be hard for people to come up with new ideas. And it was not. So you see all these domains, and then we ask the question, and it's the question I'm going to be asking you, which is, what are we missing? What are the domains we're not thinking about? So here we have substance abuse and health, we have social isolation, trauma and coping, family and individual characteristics, and economic vulnerabilities. So you have a chance again. You will go back into your group. You'll go back to Mentimeter, and we'll move it forward to the next question. And the question will be, what other information domains should we consider to help us monitor hotspots of substance use or its effects? And as a reminder, I'm going to tell you again, the ones that we have on our list are just about substance use generally and about mental and physical health, social isolation, trauma and coping, family and individual, and economic vulnerability. What are we missing? And at the center of this is this little marker to say, remember that we kind of grow out. So love to hear your ideas. I'm going to move you back into your breakout rooms or re-invite you to your breakout rooms and come back and talk in 10 minutes. So you should get an invitation to go back and join your group. responses. So we've had 49 responses so far. I'm going to leave it open for another minute or two. Feel free to continue to add things using the code at the top of the screen. And while you do, I'm going to read some of the things that we heard back. So the question was, what did we miss? We thought we were being really good and thinking really clearly. And what we see here and what we saw when this was actually presented was we just started scratching the surface. We needed to think even more broadly. So education exclamation mark, that actually shows up a couple times. People want education. They need to understand what the education rates are and what this means. This prescriptions given by doctors is a big one. That was something that IDPH also recognized as a big one. We have covariates, we have comorbidities in here, school districts, education systems, corporate pharmaceutical infrastructure, again, super important, regulatory changes, shifts in laws in states and surrounding states. That's a good one. We're a border state with the state. What's that? Yeah, Jesse's like, did you just give me an amen on that one? Yep, this is a really important one. You know, in Iowa, we're a border state with this, a state that has recreational marijuana. So that's going to be really important if they want us to be measuring marijuana use in our state. Transportation, this is a crucial one. You know, can people get to the treatment centers they need? Can they get the recovery that they need?
About that.
What was that? I think I heard someone else give me a shout out on that one.
Oh, yeah, I said I didn't even think about transportation, but it is crucial.
Yeah, so important to this. Legal, mental health services, judicial data, prescriptions again. You know, I love this access to drugs. Our team did use the pills data set. We're continuing to try and get that at the granular level, but that requires data sharing agreements. Health system, health infrastructure, career fulfillment. This is a great one. So Vicky at UVA is really trying to take this issue on. What training is available in these communities? Location, tourism, travel, police reports, policies, spatial information, absolutely. Geographic, political, the description, the usage rates again. Okay, excellent, excellent job. I'll share with you that some of the ones that the state people came up with, and I see a lot of them here, were stress and allostatic load, insurance coverage, food security, access to childcare, structural biases, including racism, sexism, ageism, etc., and criminal justice involvement. So we've hit a lot of these very similar things that the people in the field were talking about. And a big learning here, and hopefully something you'll take in with you when you do this, is no matter how carefully you thought about this or the literature that you reviewed, it's always good to go to the experts. And the experts are the people who work in this every day, and ask them what they think. And those experts could be a community member, it could be the mayor of your community, could be the CES professional helping you, it could be an administrator at your university, or a state or local government official. So these are excellent, good job. And we will go back to our presentation. Okay, so we just answered this question. And now we get to move to our next question, which is kind of the heart and soul of this whole point. You thought we were going to be doing data discovery and talking about data, and now we've spent more than half of our time not talking explicitly about data. But now's your chance. So we started in the last one and we said, what are the domains? And those domains are the things that are at the top of each of the boxes here. So we have the same old domains we just talked about. And then what these great big bright red arrows are saying, your domains that you just came up with, that whatever it was, 58 new ideas of things that we should be considering, imagine that you're writing them in here, okay? So pause for a minute, think about all the stuff we just talked about. Education, transportation, childcare, pill distribution, mental health facilities, physical health facilities. There were so many. Okay, all of the many things that we just reiterated and that you talked about in your groups, right? Now we want to think what data might be available across all of these domains. What data have you heard of or do you know about related to substance use and health? What data have you heard about, do you know about, maybe you've used related to social isolation, economic vulnerability, family and individual demographics, or any of the items that we just brainstormed? Because all of those might help bring to bear some answers to the questions we're trying to seek. So for your next activity, you get to go back into your groups. We're going to have Mentimeter again, and you get to answer the question, what data sets do you know of that would help us monitor substance use and its effects on individuals and families? And think as broadly as possible at this point. Okay, I will put you back in. You have 10 more minutes, and then we'll get together and the fun begins to see what everyone came up with. Data sets. We have 64 here. I had mentioned that when we did this with the state partners, we had about half as many people going through this activity, but we came up with 94 data sets. So feel free to keep adding if you have that competitive spirit in you. And hopefully you had a chance to read these as they've been scrolling. There's lots of really great ideas in here. I will mention that some of these, the question was, how do you monitor it for individuals and families? And some of these data sets are amazing. Like this one on the top left, adoption and child care analysis and reporting system. So in our state, about half of the cases of child removals are related to substance use issues. So if you really wanted to know the impact on families, getting that DHS data on child removals would be a really good way to be able to target and monitor that. So these are excellent data that you guys have come up with, excellent. And so far in this process, we've been saying, think bigger, think broader, think of all the different kinds of data. And I love that there's image data in there, there's social media data. As these are scrolling through, you'll see that people brought up procedural data, geospatial data, many of the different data types we've talked about. Okay, so we've gotten bigger and bigger and bigger. And now it is time to start thinking, we have to be practical. How do we move forward? You know, a lot of people get really, you're presented with all these choices and then you feel really stuck. So now is the time where we start going in and in and in. There's been questions around the team about whether this next process, when we say, how should we screen, if this should be part of what you do with your partners. And we had a really interesting conversation, Sallie and I, the other day about this, and we both came away with, we think you should screen. We think that as you're going through this process with your stakeholders, it's really important to talk to them about the criteria that they would use to decide the data sets. And that's one of the reasons you do that is you help them remember that there are parameters around what you can do. You can't magic up data. It's really important to understand that some data are more fit than other data. And in some ways, it's just part of the data acumen job that we have. So when you work with lots of stakeholders, one of your jobs is to help people feel familiar with data. And that also means being able to share with people what the confines are of data. So let me switch over to our presentation. And this will bring us to our last activity, which is much shorter. And this is where we decide what information do we need to know about the data to determine its usefulness. And really all you're kind of going through and saying is, you want to come up with a standard of criteria that you could say, I want to keep this or I want to shelve it for later. Don't think of it as like bad data that you're throwing away. You're just saying this probably isn't something I'm going to pursue right now. We have limited time, we have limited resources, human and technical. So let's just focus on these like low-hanging fruit, high quality data sets that might give us the most bang for our buck. So how do we determine what those are? So one of the ways that we think about this is we develop project-specific criteria. So you'll do this for every one of your data science projects. At our university, and I know at many of your universities, you're on multiple teams, right? And each team might come up with their own data screening ideas of what should be included. But here are some really common things to think about. So first, how fine of geography is needed? Do you need your result to be at a community level, at a neighborhood level, at a county level, or is giving some statewide number good enough? So for the question you're answering and the analysis you need to do, what kind of geography do you need? In our case, we knew that we had to at least get it to the county and preferably to a finer granularity than that to really help the state understand where to put its resources. They would much more like to have this at the community level. The second question is, what's the data quality? Are there gaps or other concerns? So we found that some of the data that we started pursuing hadn't been collected for very long, or the questions were only asked sometimes, like every 5 years, or they got a new system, and this happened on 2 different data sets. They implemented a new system and they got rid of or lost, or there was a problem with the warehousing, and they don't have any of the historical data anymore. So do you need historical data? So you want to ask those sort of questions about what you need from the data. So how frequently are the data collected is a big one. Do you need this long time going into the past? Do you need this something that's happening going forward? Do you need this quarterly? Do you need it monthly? Do you need it yearly? How often are they collected? And how difficult are they to access? So some data sets cost money. One of the data sets we use regularly for our work is vital statistics data, and we have to pay $5,000 for every year of vital statistics data. And on top of that, we have to get a legal agreement. And every legal agreement has to be signed by the deputy director, as well as by the bureau chiefs, as well as by the attorney general. And it's this long process to get data. But we find that it's worth it, and it's worthwhile going through it. So currently I have something like 23 different data sharing agreements with different agencies and groups to use their data. But it's a cumbersome process. And as you're thinking about a 10-week window, is this really something that you can take on? So that's one of the questions you need to talk about with your group. It might be the perfect data set, but if you can't access it until week 9, is it really something that you can use? And then the fees. Sometimes the fees are so expensive, it's just not very good to do that. Okay, sorry, I just saw the chats where like 5 of you did tell me that I was on mute, so thank you. I just wasn't reading the chats. Okay, so this is what we're doing in data screening. We're saying what are the things that matter to us, and how are we going to use that to narrow down from this enormous list of, you know, whatever it was, like 60 additional data sets to think about, and how are we going to bring that into something that's easier to manage? So here are those same sort of ideas. You want to ask very specific questions. So what I'm trying to show you here is when you actually go through this process, when you go through it with your teams and when you go through it with your partners, you want to have yes/no questions, and you want to have very specific questions. So my question would be, does it cover at least every county in Iowa? Yes, no. Or is there greater geographic granularity? Yes, no. So the screening question was, what geography do you need? My very specific question was, is it at the county level? The screening question, does it cover the time frame of interest? So for me, what I need is it current? Did it happen in the last year? And how far back does it go? The screening question, is it shareable now? Meaning, do you need a data use license to use it? And some of the questions would be, how are the data accessed? Are they open? Are they legal, regulatory, administrative restrictions that would keep you from accessing it? Is there a cost? Is that cost one time or annual? Is it project-based? Does it have high enough quality? Are there serious gaps or concerns? So in each of these, you're going to ask the question, you're going to say yes, no. That yes, no is important because you want to be actually to go through the data sets that have been suggested. And you want to say, yeah, overall, this looks really good. Or like, no, across the board, these are no's, it just doesn't work for us. So as you're developing it, these are the sort of questions that you might think of on your team. Now with this very specific question in mind about substance use in Iowa, I want you to go back to your groups, and this time it's only for 5 minutes, and you just want to brainstorm what are additional, there should be a T here, what information about the data sets will help you determine their fit. What else should we be thinking of so we can winnow those 60 data sets to probably like 5 or 10 that we might want to start with. So I'm going to move you back in there. This time, again, it's only going to be for 5 minutes. And just brainstorm what sort of information do you need to know to determine if this will work to monitor substance use in the state. Higher data sets, and some are just useful ways to think about data in general. So, you know, clustering, is there clustering? What is that? This bias, several of you brought up the question of bias here. And I think that's really important, and I hope that you ask that of every data set you consider. So one of the questions or one of the points someone made was that, is there bias? If you're using judicial data, is it biased? Great question. So think about that. Who would it be biased towards? What would that mean? How does that limit what you can say using that data? So every data is going to have flaws. Every data will have things that hold you back. Some of the best, most extensive data that we have, and I'm thinking of Todd right now, who's participating in this session, is he's working on these childcare assistance data. And it was difficult to get and took lots of legal agreements and tons of time, and the data were super messy. But at the end of the day, we were able to just get an indicator of yes, no, did they receive childcare assistance? And in order to provide the insights the state needed, that's all we needed. So we combed through decades of data for real, and lots of super messy data. And we were able to deliver something useful off of just constructing an indicator from the data. So what do you really need from the data is a question you should be asking. Do you really need fine-grained, perfect assessment? Do you need to have these results that are optimal, or do you just need to have like a big high level, this is enough, this can tell us enough? So I want to take these questions of bias and what do you really need, please, and apply them to every single data set you have. But then practically, this stuff is great. What can you combine? Is it current? What's the format of sourcing, the quality? How well does it represent the citizens? I loved that question. How frequent? Was it collected ethically? And if not, can we justify using it? Great question. And these are the sort of questions, this is one of the reasons you want to have this discussion with your clients and stakeholders and partners to make sure that you're on the same page and you understand what you can pull and use from this data. Okay, so now you've gotten this far and we have these amazing ideas about all the data we can use, and then we have really good ideas about some ideas from screening. We've talked to smart people. We've thought about it a lot. We've decided what we can keep and what we can shelve intellectually, and now we need to put all that thinking into action. So we're not going to do this in a breakout, but I just want to describe what you'll do with your team. So you've done this screening. You know, these are the kind of what you see is the imaginary paper we would be writing on if we were in person. And that might have some of the basic questions that we always ask. Does it cover the geography of interest? But again, remember, we're going to ask these in like very specific yes/no questions. And then at the end, you want to describe any of your additional items. What did your team, your partners, what did you come up with that you want to be additional screening questions? And those are the many things that were just floating before us on that Mentimeter. So you'll write all of those down. You'll decide which ones really matter. You know, sometimes when I'm developing a rubric like this, I might have something that's like highlighted. If they don't have this, I just can't use the data. If it's not current and it's not repeatable, I just can't use it. So it will automatically be thrown out. But sometimes it's a matter of like, is it mostly good data? Is there a way that I can use it that's still useful? So identify which of these questions are deal breakers for you and which of them just let you know where to start in the process. Like, I'm just gonna go after the best data to begin with that are the easiest to get, the lowest hanging fruit. So you can use this list to kind of evaluate where to start in your data collection. And you do that by identifying all of those things that you care about for screening. And then you write down the name. And in this case, this was going to be an activity and we said, no, we'll shorten this a little bit. But you can write down the names of your data sets and then you fill in the answers. Yes, no. And we're data scientists. We would probably not do this with pencils and paper, but you will actually go through the process and identify and code and grade and assess and throw in your word that you want here. And you're going to evaluate. At the end, you just need to evaluate if all of that brainstorming of data, if it actually translates to real data, first of all, because what we find is people just write in things like, I have an idea, I think human trafficking data is good. But then we actually have to find human trafficking data, and then we have to write answers to these questions. Is it usable? Does it fill this step? So after you've met with your partners and you've come back, this is what you're going to be doing in your team. You're going to be writing down all of their ideas, you're going to be evaluating them, you're going to be judging them, and then that's what you're going to move forward in collecting as the beginning of your data pipeline for your project. So I know this is a lot. This is a lot of stuff that we've covered, but I hope you can see why I just genuinely love this part of the process, because you're joining with partners, you're getting their ideas, you're assuming and telling them that they're the experts, which is true and should be fundamentally the way that we treat our partners. And then you're going through this process to get something really usable, which is how do we start that next step? And it makes it a little less scary about how do we engage with a problem when it's something totally new to us and we don't have substantive expertise. So this is the end. That is it. I want to open this up for questions, but please know that we really appreciate you being here. And hopefully when you give this lecture and you talk to your people, you let them know how much you appreciate their time and effort. People are busy. COVID is going on. There are riots in the world, right? You all know this. They all know this. Make sure that you really thank them and tell them how appreciative you are for taking time with you to work through these sort of issues, because they're critical in developing a good data pipeline. Also, make sure you give your contact information. Here's mine, here's Sallie. Reach out to us if you have questions. You can also reach out to the many wonderful members of the SDAT team who have gone through this process and go through it regularly. And I will again give a shout out to Devika, who's here, very good at this job. I also want to give a shout out to Sean and Kelsey, who helped me run this in real life back in October and who are here. So thank you very much for that. And to all the fellows who worked through that breakout room. That was a little rough start, but that was kind of fun. I'm glad. I think we'll do that again over this process. So thank you, everybody. And now open to questions. Any thoughts, questions, ideas?
Where's that? Will that PowerPoint be available?
Yes. I don't know who is posting it, but I've already shared it with someone.
We can put it in.
If not, I will post it. Do you know the answer to that?
It will live in Teams. So eventually you'll see an entry for it with the recording.
Cool.
To what extent can we anticipate that the stakeholders might know of useful data sources?
That's a great question. So I've done this now with a number of very different sorts of groups, and they've had very different abilities in terms of their data acumen and their use of data. But in all cases, people are aware of kind of like that data floats. So when we're working with the state epidemiologists, and this is their job, they gave very specific answers about the names of the data sets, and sometimes even like the questions we should be looking for in those data sets, and that's rare. Like, don't be thinking you're gonna get that from everybody. We did this with the League of Cities and with the AARP, and one of the women that I sat next to in that session, we did brainstorming and everyone wrote on a paper. She, in about 5 minutes, wrote something like 34 different data sets that we could use to look up fiscal responsibility. I mean, it was just astonishing. So sometimes you have these like moments of people who are excellent at thinking of data, while other people might have one or two and they might be really vague. But if you can give them prompts, it's really helpful. So think about like every form you've had to fill out is a data set that someone collects and likely keeps somewhere. Is there anything in like the forms and as you live through your daily life and fill out the stuff for your cars and your house and your kids and your insurance and your education, whatever, is there data being collected about you anywhere that you think would help, you know? And if you're working with city managers, they have lots and lots of data. They might not like it, they might not use it, they might not have someone whose job is to use it, but they'll be aware of it. And so it's really useful to think about it. What I want to say, and I know that I say things like this regularly, so some of you are likely going to say, we've heard this before, but I'm going to say it again because I think it's really valuable, is rural communities are often sitting on a mountain of data that they're not using, and it's an asset. And we're trying to help them develop a long-term approach to data to activate that asset and make it work for them. So this process of having them think about what data do they have and how could they use it to solve their own pressing problems is a really valuable way for them to invest in their own future. So take time in this and help them think about the prompts that will help them think about what data they have. So don't let people brush this aside. This is important. We're trying to develop a pipeline for them to dig into their own assets that will help them in the future. Thanks, Grant. Any other thoughts or questions people have?
Cass, can I add something?
Yeah, please.
In particular for the students everywhere, as you guys start to take on this process with your teams and your projects and your stakeholders, two things. One thing Sallie always tells us to do, and I said this in my breakout room, so you're going to hear it again, always start with the federal agencies. There are maybe 50 major federal statistical agencies, maybe 100 plus minor, spin-offs or subdivisions. They all produce data, they all publish data, and they're a great place to start. The other thing is, I think sometimes half the battle is knowing what to Google. And I would say a lot of the times you'll find in academia or just out in the world, people are doing a lot of the same work or researching the same idea, but calling it something different. And so sometimes it's a question of just finding, the way the public health sector talks about something versus how a medical professional like boots on the ground would talk about something. It might be the same phenomenon, but it has 2 different terms or 5 different terms. And so definitely the benefit of work like we're doing this summer is that you're on an interdisciplinary team. You can talk to people who come from a wide variety of academic backgrounds, and you can sort of prod them for those ideas. But as you're thinking about how do I go out and find data, that's definitely something to think about for yourself in terms of how you're looking for it as well.
Thank you. I want to follow up on that, and please use your reaction buttons. I'm curious, use thumbs up if you did it. How many of you Googled while you were in your breakout rooms? Okay, good. That's a great sign. And you can also ask people, so back to your point, regularly people, when we're working through these things with them, are Googling, and that's great. You don't have to keep all that knowledge inside of you. If you're really thinking, if you're going down a path and you have an idea of what it would be, use your resources and try and figure it out. Super helpful. What else do you have for it? That was really good. Do you have any other comments for us?
No, those are my top two. Sorry.
All right. Any other thoughts, ideas, comments, or concerns? And otherwise, you get to go. Okay. Feel free to send them to me if you have questions and we'll respond, but it was great to have you here. Thank you for participating, and good luck in the next couple of weeks using this tool set with your own communities and people. Thanks, everybody.